Dr. Stephen Davis gave us the lowdown on breast augmentation a few weeks ago, and now he's back, as promised, to share advice for the big busted women out there wanting to know more about breast reduction. Welcome back, Dr. Davis.
Hi, nice to be here.
So why would somebody want to have this done?
The trend is starting to become more like they want to be in shape, they want to be more fit, and I think a lot of women that have really experienced having too much breasts really want to start going in the opposite direction.
Yeah, I mean, I was just saying, there was a woman who recently had she was 36 triple N.
Wow.
And had a reduction to double Ds, and I can imagine the pain on your back and all of the,
Most of the
association.
girls that we operate on that have that condition say they wish they would have done it years earlier because it changes their whole life.
Right.
They're able to start participating in sports that they never were able to do before. They can buy clothing that they were never able to buy before. So I think once they have that and they can see how much better they feel, it's a tremendous physical improvement.
Right. What are some of the physical discomforts besides back pain?
Right. Neck pain, back pain, a lot of bra straps that start to groove into the skin. And more than any of that, I think it's more about a psychological type of feeling because a lot of these women really matured at a very young age. And it just tended to trend them towards a psychosocial behavior that they really may not have been ready for. So I think once they change that up, a lot of things change.
So what are some of the treatments for this?
Well, what we've been doing for years is a standard breast reduction. So somebody that comes in, like you were saying, that's that enormous, and they really want to get smaller, we would do a standard breast reduction, which is a surgery that takes probably about 3 to 4 hours to do, and it takes a week or two to really recover from. But the trend I'm seeing is much more about a perky lifted type of a look. So in a sense, it's still considered like a breast reduction, but in reality, it's more of a breast lifting event.
Right, and it's still your own. You're not putting an implant in.
That's exactly what everybody talks about. A lot of times the women will come in and they have plenty of their own breast tissue, but it's in a very low position. So what we can do is we can alter the amount of skin that's there, so make the skin tighter and actually house their own breast tissue in a tighter skin envelope. And it looks like they have breast implants, but it's really their own breast tissue.
But for recovery, for an augmentation, or just even, a reversal, what do you get scarring? What is that like?
There is some scarring, but if you place it in very hidden areas, you really can't see it once it's all healed. The most important part about it is you really want to be on the same page with the patient so that everything is starting to change. So their diet, their exercise regimen, everything about that procedure should be geared to really getting them back into shape because that's really what they want to do.
What are some of the trends among young women that are coming in to see you now?
Yeah, I mean, I've been in practice long enough now to have seen the whole pendulum swing.
Right.
But now we have girls that are college-age girls that really want to get smaller. They come in and a lot of times they have an asymmetry that may have been the instigating event. So they have one breast that maybe is like a full B and the other side is like a D.
Wow.
So we see that a lot, and what they would like to do is try to match the smaller side. So we may make one side a little perkier, but the other one we actually have to do a reduction in. But we're seeing that more and more in the younger girls that want to be like fitness models or in that really good physical shape. Trying to alter that changes a lot of their appearance.
And getting a reduction, is there a lot of risk involved as opposed to getting a breast implant?
It's actually less painful than a breast augmentation, most people say, because you're really not putting anything in, you're just taking stuff away so that the muscle isn't being really altered. But it's a downtime because there's a lot of stitching.
Right.
So it's not that it's so painful or that it's such a terrible recovery in any way. I think it's more about just making sure that you're not getting back to doing things too quickly because you want to let everything heal.
Heal.